I have a unique approach to peripheral nerve pain that I'm going to tell you about. Let me give you the backstory of how this developed, and there's some new products out there that you can actually use at home to do some of this yourself. So it's very fascinating. So hang tight with me. I'm going to give you all the details in this video. My name is Dr. Story. I'm a doctor of chiropractic. I've been in practice for over 28 years, and I help people with natural health care. So we use nutrition, we use exercises, we use spinal adjustments, we use lifestyle decisions and choices to improve your health so that you can live a pain-free life, but a more functional life so you can actually feel good during the day. It's one thing to not have a disease, but it's another thing to actually feel fantastic. And that's what I strive to do in my practice, is to get every patient to feel the best that they can naturally. One of the problems that a lot of people suffer with is pain coming from peripheral nerves. And what peripheral nerves mean are nerves that are coming out of the spinal cord, and the ones that are most superficial very often can cause a tremendous amount of pain. This occurs in the head, it occurs in the neck, the spine, throughout the extremities, particularly the pelvis and knees. This is where I have usually the most success. In addition to that, this dermal traction method that I'm going to be talking to you about and teaching you about is useful for scar tissue. So I live in an area where there's a lot of people that have had hip replacements, knee replacements, even shoulder replacements, and a lot of different surgeries. And very often the scar tissue can become a source of pain for people. So there's nothing really on the MRI, there's nothing on X-ray to justify the pain, but they're getting a tremendous amount of pain where the surgical site was. And this method can actually help. So let me tell you about it. Now, if you Google cupping, you'll find that this has been used for literally thousands and thousands of years. Even 1500 BC, cupping has been used. And what it involves is either a glass or porcelain type of cup. These are actually the ones that I have in my office. These are made of plastic. And what they usually do is use a fire to create a suction, and it sucks the skin up, and that's what cupping is. And I'll demonstrate this in just a moment. But I use it without the fire because in my office, you know, some people are using oils on their skin, or they have perfume, or if it's near their hair, they may have hairspray in there. You don't want to be using fire near those things. So I use dry cupping, and it works really well. And what I'm doing when I apply this to patients as a chiropractor is I'm using something called dermal traction cupping. What I'll do is I'll place this on an area and then create the suction where I'm pulling the skin and the fascia off the underlying surface area, and then having the patient move their body in a position that traditionally hurts. And if we find that you can take the pain away while they're moving, then we find that it's beneficial for it. There's not a tremendous amount of research on this, of course. So you're not going to find double-blind clinical trials with placebos, because you can't do a placebo with this. You can't tell someone you're doing it and then not do it. They know that you're doing it. And to double-blind the doctor, how would the doctor be blind that he's doing this? So double-blind trials that are placebo controlled are impossible to do with a lot of physical medicine procedures, simply because you're not swallowing a pill. You can't blind the doctor and blind the patient to the procedure if it's physical. You can do that with a simple pill, because you can tell the patient they're receiving the drug when they're actually not. It's just a sugar pill, and the doctor doesn't know what he's given the patient either. So again, there's not going to be a lot of research on this, but in my office I find it very beneficial to reduce pain. So something must be happening, and it's been done for, you know, thousands and thousands of years. So who knows? When this company called Carpal Aid sent me some things to try in my office, I thought it was kind of intriguing, because they originally made one for your wrist. And what happens is, for carpal tunnel syndrome, you place it on your wrist and it pulls on the skin of the wrist, decompresses the nerve a little bit, or the space there, and people notice results with their hand. Well, they developed one for the temporal area right here, and they sent it to me. They sent me a bunch of them, and I tried these on patients. So I did kind of an in-office experimentation with patients that were having headaches, and let me tell you the results. So what I did is I took 100 patients and I gave them these things to try, and this is basically what it boils down to. The average pain level on a scale of 1 to 10, 10 being the worst pain of a headache, 0 being no pain at all, the average pain level was 4.44. And then after using the product, 5 minutes later, the average pain level was 2.63. So the average headache pain relief was 41% reduction. That was the average. Now, of the 81 patients, the lowest improvement that I got was 0. In other words, there's always going to be some people that nothing works for. And the highest improvement, some people got a 67% reduction in their pain levels of their headaches. And these were migraine headaches, tension headaches, temporal headaches. It didn't matter what type of headache. But out of those 81 patients that got back to me, 15 patients had no change at all, but 66 patients reported some type of improvement. So something is going on with tractioning the skin over an area of pain. And there are 3 hypotheses that I have in regard to how this works, based on my own thoughts, just simple structure of anatomy, as well as what I've researched on the history of this type of thing. So let me tell you what they are. And before I do, let me just show you how this works. What happens is if a person's getting a headache, what we're talking about is we're talking about placing it on the temple. So let me take my glasses off and show you. You just remove the adhesive part. You're going to place this right above, behind the eye. There's a little ridge where the bone is, and you don't want to be on the ridge. You want to be back here, right next to the hairline. So as far back as you can. You place it and you press on it here where typically people get headaches, and then you just let the suction happen. And I don't know if you can see this. Let me see if we can do this. If you can see up close how it's pulling on my skin there. It's pulling. So it's pulling. I mean, you could literally, you can feel this, that it's pulling out this way and relieving some pressure. Kind of interesting. You can put it on one side or both sides, and it just comes right off when you're done using it. The first theory of how this actually works, it's based on neurology. So let's go get a textbook, and I'm going to show you exactly what I'm talking about, because you need to know the anatomy first to understand why this might actually be beneficial. All right, let's look at some anatomy here. So here are the cutaneous nerves of the head and neck, and this right here shows the trigeminal nerve. So here's the ophthalmic division, the maxillary division, and the mandibular division. And we're going to look specifically at the ophthalmic division. And what you'll notice here is that there are areas right there on the temple, and then there's actually right here from the maxillary division, right there, that goes to behind the temple where we're placing that product. And look here at the mandibular division of the trigeminal nerve and how it feeds sensory information into the temple. So this is the anatomy we're working with, and then here you can see in the colors it shows where the superficial areas are. Now, according to the Association of Migraine Disorders, the cranial nerve number 5, or the trigeminal nerve, is almost always associated with migraine headaches. The second hypothesis as to why this might be working is vascular. So let's go back to the anatomy textbook and understand what we're talking about. So this picture right here shows the arteries that go through, and these are branches of the temporal artery and vein, and you can see how they go right across the temple and they intertwine with the ophthalmic arteries right here, and they really come from in front of the ear. You've got the red, which are the blood vessels of the arteries, and the blue are the veins right across in front of the ear, above the cheekbone, and behind the eye, where we would put that product. Now, what's interesting about vasodilation and migraine headaches, or headaches of any nature in this area, is that over-the-counter medication very often uses caffeine as one of their ingredients. So if you get an over-the-counter medication and it has, let's say acetaminophen as well as caffeine, very often it's the caffeine that might be affecting the migraine the most. Because what does caffeine do to blood vessels? It vasoconstricts, which means it narrows the blood vessel. It stops that swelling or the bulging of the blood vessel. Now, the advantage of that is it does get rid of your pain. The disadvantage of that is it can raise your blood pressure. So if people have eye trouble, kidney trouble, or blood pressure trouble, you don't want to be raising your blood pressure. So one of the side effects is significant. So one of the advantages of using a natural approach that does not involve over-the-counter medications or prescription drugs is simply that we're not harming the eyes, the kidneys, we're not harming your blood pressure. And if it relieves pressure on those arteries, whether it takes tension off the artery or takes pressure off the artery, just relieves strain off the artery, if it relieves pain and it works, why not do that first? The third and final hypothesis that I have in regard to how this works has been fascia and muscle. Now, again, let's go back to the textbook so I can show you what I mean. Right here is the temporalis muscle, and overlying that temporalis muscle, they cut it away right here. You can see along this path, and you'll see it says there, the temporalis fascia. And that is the covering of that muscle. This muscle connects down into the jaw, as you can see right here in this picture, and controls jaw movement. So it eccentrically loads when you're opening the jaw, and it concentrically contracts when you close your jaw. Fascia and muscle are probably one of the most overlooked causes of physical pain in our body, particularly in regard to peripheral nerves. And the fascia is that stuff between the skin and the muscle tissue, and it's intertwined. And very often, this is where I find that cupping, dermal traction cupping with movement, particularly over scar tissue, will have tremendous benefit for patients. And there's lots of different ways to deal with fascia. There's Graston technique, there's deep tissue techniques, there's active release motion techniques that you can use with your hands. But this is a very simple thing, cupping that is, or anything that tractions the skin off the underlying tissue can help people tremendously. So when it comes to the headaches, you think, well, there's the temporalis, that's connected to the TMJ. The TMJ is a source of tremendous pain when it comes to migraines and headaches and various things like that. So if you take the stress off the fascia and the muscle of the temporalis area, or the temporalis muscle or fascia over the temporalis, that could be a reason why this works so well in relieving headache pain. If you thought this subject was interesting, let me know in the comments section down below. If you have any questions, you're more than welcome to ask. In addition to that, I will put some links down below of where you can get these products in the description, so you can look them up and see if there's something that you would like to try. As a final thought, I just want to let you know my goal of this YouTube channel is to help people achieve better health through natural methods. And I put a lot of effort into these videos with editing and figuring out what I'm going to say. If you can, I just want to ask a favor. If you'd be willing to subscribe to my channel by hitting the subscription button down below, giving me a thumbs up, writing comments. What it does is it helps the algorithm of YouTube figure out that people like these types of videos. And what happens is then YouTube will share it with other people, which is my entire goal. I don't want to make these videos to only have a couple people watch them. I want the whole world to see these videos, because What have you got to lose by reducing your pain and improving your health naturally? I don't see a problem with it. But with YouTube, if people are not subscribed to the channel, if people are not commenting, if you don't share this on social media, just put it up on your Facebook or Instagram as a link. It would really help the algorithm figure out that this is valuable information that people would want to see, and that way more people would see these videos. And I realize that you don't have to do this. I'm not begging you to do this. The truth is, you can watch all my videos for free and never put any effort into contributing. And that's okay. I know when I look at my stats on YouTube that a lot of people are not subscribed. The majority are, and I do appreciate those people that subscribe. But if you aren't subscribed already, it just takes a quick second to just give me a thumbs up, let me know you like the video, put a comment down below, share it on social media, and subscribe to the channel. Thanks so much.